Well, October is Liver Cancer Awareness Month, and the liver is the body's largest internal organ and second most important organ of the body overall. Did you know that? It's estimated that more than 20,000 Americans are diagnosed with liver cancer each and every year. I want you to meet Doctors Sujit Kalmadi and Dr. Jason Salganic. They are medical oncologists at Ironwood Cancer Center and Cancer and Research Centers, rather. Gentlemen, thank you very much for joining us today and giving us some information about this terrible disease that people can get. Dr. Salganic, I want to start with you. First of all, define really what is liver cancer? What's happening?
Sure, good morning. So liver cancer is cancers that come from the liver cells themselves, not to be confused with cancers that come from other parts of the body. For example, unfortunately, a lung cancer that might spread to the liver. That is not liver cancer.
Okay.
So liver cancer will come from the liver cells, usually from a very inflamed liver, cirrhosis, or hepatitis. Really hepatitis B and C, not hepatitis A. Hepatitis A is just a food-borne illness that won't get you. Those are the main problems and ways that you might contract liver cancer.
So, Dr. Kalmadi, when somebody comes into your office, are there certain types of symptoms that they're experiencing that are very classic, and then from those symptoms, how do you diagnose it?
So a lot of these are picked up during screening procedures, ultrasounds which are done for patients with inflammation, like Jason said, and those patients tend to have a lack of any symptoms. By the time yes.
So you don't even know that you have liver
correct.
cancer when most patients are all, is it just that way, all patients?
So that's one of the biggest fallacies in cancer, is that by the time you get symptoms, it's usually too advanced. So for instance, jaundice, yellowish discoloration of the body, is a fairly advanced sign of liver cancer.
Oh my gosh, that's frightening.
Yes.
That is absolutely frightening. Dr. Salganic.
But there is a way out. I mean, patients who are at risk, if they're known to have hepatitis, if they have cirrhosis, if they're heavy alcoholics, they should be on a program where they're getting screening tests and ultrasounds so they can catch them early.
Okay, which is a good point to make. So if you are in that category, you should be screened
Correct.
more often?
Absolutely.
Like once a year, twice a year?
Sujit, I think it's about every 6 months.
Okay. All right.
That they do ultrasounds.
Okay, so that's important to know. But if you're not, is there a way to prevent it at all, liver cancer?
You know, I have a little factoid. Well, one thing is don't get hepatitis, right? And if you are an alcoholic and you can stop and sober up and help your liver heal, you'll prevent it. There are treatments for hepatitis. And here's a little tidbit, but it's not entirely proven, but there are some studies that have shown that there might be a positive benefit for coffee.
Thank goodness.
That's right, all you coffee drinkers.
And I know that, you know, technology and research is advancing every single day. Doctor, what's the future look like?
So there are a couple of things which has happened which is very fascinating. Hepatitis C, which is seen in a baby boomer generation, there's a high preponderance between 1945 to 1965. Anybody who's born between that. So that's very treatable now and curable. So with that decline in incidence of hepatitis C, that's going to result in decreased incidence of hepatic cancer down the line. That's one thing. Second, the most fascinating area in oncology is something called immunotherapy, where you make your own body fight against the cancer. So that's advancing fairly rapidly in liver cancer.
Wow, that is fascinating. Well, I want to thank both of you for coming on today and making us aware and educating us. And it's a terrible disease, but it's good to know that it is preventable. So thank you very much, doctors. If you want more information, Ironwood Cancer and Research Centers has 9 Valley locations. You can book an appointment. There's just one number to call, and you can find a location near you, 480-821-2838. You can learn more at ironwoodcrc.com.